A child about to undergo surgery not only feels stressed and frightened, but so do their parents. Dr. Manoj Kularni of Children's Hospital of Orange County explains what parents need to know to reduce stress and anxiety in their child and also for themselves.
Most people think of an anesthesiologist as a gas passer or somebody who knocks out a patient. And that is true, and we wake them up at the end of the case as well. We are specially trained physicians who care about the safety and comfort of the patients. And we usually work in the operating room, although we're also known to work in intensive care units, labor and delivery, and recovery rooms as well. Dealing with anxiety, especially for pediatric patients, that's a big role of a pediatric anesthesiologist. Luckily, we have a great team here at Chalk Children's. We have the anesthesiologists, we have nurses, we have child life specialists. Everyone's really designed around taking care of the patient and taking care of the families as well, giving them the information and the education that they need to be comfortable during a surgery or before the surgery. The anesthesiologist is the person who's most responsible for taking care of the child. So they are usually going to ask a very detailed history about the kid, about the family, whether there's ever been any reactions to anesthesia. They're also going to need to know about the goals and expectations from the parents and the child to see how to best prepare them for surgery.
We wondered what type of anesthesia is used for pediatric surgery and what are their side effects.
There are different types of anesthesia. Most commonly with kids we do general anesthesia, so that means they're completely asleep, they're unconscious, and the anesthesiologist is there watching them the whole time. There's other types of anesthesia, including local anesthesia and regional anesthesia, and that's when we can numb up the particular area we're working on. For instance, if they're having a foot surgery, we can numb up the area around the foot, and they can be very comfortable if they're the right type of patient. Every type of anesthesia has side effects. It's our role to minimize those side effects. Some of those side effects affect the breathing or the heart rate or the blood pressure, and as anesthesiologists we're trained to deal with these changes. We're watching them on the monitor all the time. In every case we're very good at keeping the patients safe and comfortable throughout the whole procedure. One other common side effect is nausea and vomiting, and we do take that concern seriously. We often give patients medications to help prevent it, and after most surgeries, most patients get through very well.
Dr. Kularni explained the role parents should play before their kids go into surgery.
Parents have a really important role preparing a child for surgery. They are probably the best bridge for information, for providing that sense of calm, dealing with that anxiety. So parents, usually we advise them to get as much information as possible. They can contact us, they can contact our child life department, they can learn more about the process. And by learning more, the parents can stay calm. Kids are very good at picking up on body language, and they really know when a parent's anxious or if the discussion is just a little bit more tense than it should be. So if the parents are well educated and prepared, they can help be reassuring to the kid.